Uh-oh. So this is, it's, I'm going to record my screen for half a second.
Okay.
Ugh. So can you still hear me, I think?
Yeah.
My assistant created these links and it's telling me that this thing was deleted on Facebook. All right. Very good. All right. I'm going to go ahead and take us live for a minute. Thanks for joining us. This is Dr. Madeline Hoffner. She's here from At the Core Physical Therapy in Annapolis. And we're going to rebroadcast this later to Facebook because I think our link is broken. So we're going to go ahead and start with what we've got and just go with it. All right, Dr. Hoffner, can you introduce us and tell us a little bit about what you do?
Yeah, so I am both a physical therapist and a Pilates instructor. I am based in Annapolis, Maryland, and I have my own little private studio in which I just see patients one-on-one for a full 60 minutes. And it's the way that I've really always wanted to treat patients rather than be in a crazy clinic and like going just back to back. And I really feel like I'm finally able to give patients the attention they deserve.
That's awesome. Yeah. And I kind of jumped right into it because I was having a little technical problem. I would share, I'm Sarah Merritt with Lifestream Health Center. We're in Bowie, Maryland. So Madeline, Dr. Hoffner and I are actually sort of neighbors in the sense that we're in towns that are close together. And so the beauty of a broadcast like this is that we can reach a broad audience of people that might or might not be local to us, but that we're able to cross refer, and that's a great thing.
Yeah.
So I think that we share some similar, approach or feeling in my world too, as a pain management physician, right? There are practices that work in different ways as well. And we're a small practice and very similar, able to hopefully spend a little more time with our patients, offer possibly a little more personal attention in some ways from the physician or provider, because we're just, a smaller thing with a different focus.
Yeah.
So yeah, I love that. I think that's, for me, that's part of like that therapeutic relationship, right? Is connecting with a patient, being able to offer them your time and knowledge, experience, and kind of applying it to their individual situation. How did you get interested in physical therapy and in being a physical therapist?
Yeah, so I actually feel like I have a little bit of an opposite story of most physical therapists. I feel like all of my classmates were like, athletes that got injured and then went into physical therapy and they were like, I like this. And I think for me, I actually more so got curious from others. And I was still an athlete, I was a gymnast growing up.
Mm-hmm.
But I think that first curiosity actually came from a teammate who had broken her arm twice. And it was like pretty dramatic. And I saw it happen both times. I was like there to witness her arm just like being broken. And she went to physical therapy each time. And I was just so amazed how she came back even stronger than before. And I was like, what kind of magic did you go to? And I was really young at the time. I mean, I was probably like, 10, 11, 12, just like being like, where did you go? And how did you just like bounce back like that? I did eventually go to physical therapy myself, but I never had any like huge serious injuries from gymnastics. And I can get into that a little bit later as to why I think that was the case. But I think I just got really curious about movement sciences and, different body mechanics just from the sport of gymnastics, and then again, just seeing my one friend just come back better than ever.
That's impressive. Yeah.
Yeah, I was like, where did you go?
Yeah.
Um, and then, it was really interesting too, because I kind of knew very early on that this was my path. I never like
Hmm.
wavered away. I specifically looked at colleges that had, a kinesiology program or exercise science program, and I like stuck with it the whole time, which is rare for me being a relatively indecisive person.
Yeah. You got interested in the interest stayed, I guess.
Yeah, yeah.
Well, and tell me a little bit. So I know in your practice, you have obviously you're a doctor of physical therapy. You're qualified and able to provide those services, but then you also have this strong interest in Pilates, and that's really, I guess, separate. I mean, it probably isn't all that common for someone to be a certified Pilates instructor and a physical therapist. I'm sure there are some, but tell me a little bit about your journey in Pilates, and then we'll get to how that impacts your practice.
Yeah, so Pilates actually came first, and
Mm.
as I said, I was a gymnast. My gymnastics coach was actually a Pilates instructor as well.
Oh. Mhm.
So she had worked Pilates into our like daily warm-ups at each practice.
Mhm.
So again, I was probably like 8 years old doing Pilates. I didn't know I was doing it at the time.
Mhm.
Um, but I do honestly feel like that is the reason myself and my teammates had relatively few injuries and that we were so successful. And I think we just kind of grew up with this added awareness of our core and our trunk and how to move in ways that were efficient.
Mhm.
And I mean, gymnastics gets a really bad rep of injuries, like
Mhm.
all the time. You're
Right.
constantly getting injured, and I just can't think of any other reason why our team stayed just so strong.
Yeah.
And so,
Well, and tell me more about like kind of what Pilates really is. So somebody
yeah,
who are unfamiliar, what does that even mean? I think it's like a person's name maybe, but
it is. Yeah,
what is it, and what does it really mean to have core strength? I guess even for me as a pain management doctor, if I'm treating somebody and suggesting they do physical therapy, building core strength may be one of the things that we, suggest they work on in physical therapy. And what does that even mean?
right. So I'll start a little bit with the history of Pilates. It is someone's last name, Joseph Pilates.
Hmm.
He was actually kind of a German, movement person, and he was helping to rehab soldiers
Hmm.
in the hospitals and kind of like MacGyvered this kind of spring and strap system to help people move when they couldn't necessarily get up and walk yet. So that's why the one of the equipment that's used in Pilates called the reformer
Hmm.
is kind of almost like shaped like a little narrow hospital bed. At least the one that I have and you saw, it was like kind of
Yeah.
narrow. It's metal, um, and so he kind of brought this idea to the United States. It kind of originated in like the New York dance scene. So
Hmm.
a lot of like with ballet and stuff like that.
Hmm.
And it kind of evolved into this, I think people started really noticing that it was very therapeutic and it was very kind of like rehab based. And there were so many benefits to getting into the deeper core muscles, not just kind of the superficial, like six-pack muscles, but getting into the muscles that actually help to support the spine and kind of wrap around the body. Um,
Hmm.
and to me, as a physical therapist, I very much think about the core as more of a cylinder. So it's not just the front of the body. The core is both the top being your diaphragm, the bottom being your pelvic floor,
Hmm.
and then, the back, the front, and the sides. So all of the muscles that kind of make up this cylinder is what helps create stability and, proper, efficient trunk movement.
Hmm.
Um, so Pilates can be a number of things. It can be on the mat, so pretty much no equipment, just your body weight against gravity. And then, as I mentioned, there are a lot of now like evolved equipment-based Pilates. So
Hmm.
the
Like the
reform,
ball and the
yeah, yeah,
weight and things that are equipment, but not the full
yeah.
reformer thing that we've all seen probably at a gym.
Yeah, there's tons of toys now that you can kind of supplement a Pilates practice with. Um, but a lot of people wonder what the differences are between Pilates and yoga,
Hmm.
which I get is a really common kind of like they're often kind of grouped together in a way.
Sure.
And I do find there to be a lot of overlap. However, Pilates doesn't really have many like holding poses per se. We kind of keep it flowing through. Most of the exercises are done either on your back, on your side, on your stomach,
Hmm.
hands and knees sitting. There's not as much standing with Pilates, which
Okay.
makes it a great exercise for people with balance issues. And then again, people who have, POTS and things like where direction changes and position changes are not necessarily gonna be, the best with moving up and down as yoga is sometimes.
Yeah, yeah, that's a great point.
Yeah, so it really is for everybody.
Mhm. It
You
can
know,
be adjusted, it sounds like, to a lot of different abilities or limitations,
yeah,
etcetera. Like, on the one hand, I hear you, like, there are these athletes that use this because of their being, dancers or gymnasts that want to build strength, but then on the other hand, it's very adaptable to someone who's not athletic.
yes, yeah, all ages really do benefit. I've like again done Pilates with people who are, 7 years old to like
Mm.
80 years old. You know, there's actually really funny videos of football players doing Pilates.
Mm, mhm.
They're obviously so strong, but
Yeah,
you get them into this really specific, like targeted core exercise, and they are just like, oh my God, why is this so hard? And it's pretty funny and entertaining. But yeah, I do find it to be, really safe and really helpful for lots of different populations.
that's awesome. Um, yeah, and so this is a tool that can be used for a lot of different populations. You work with people as a physical therapist, and you have a practice that's also just Pilates. I think also if people were
Yeah.
to work with you in that way, just as in terms of the Pilates, in terms of the fitness, and then it sounds like there's this overlap where your knowledge of Pilates may just inform even how you work with folks as a physical therapist.
Yeah, as I went through PT school, I started kind of noticing that the way I wanted to provide different treatment and exercises was
Mhm.
kind of like what I had learned in my Pilates training. And so I kind of call it Pilates-based rehab, which is where I still do a full, physical therapy evaluation and
Sure.
assessment and do any tests and measures that I need to.
Yeah.
But when it comes to treating certain injuries or pain, then I often find at least starting off with these kind of core foundation and introductory Pilates exercises helps people build that awareness of
Mhm.
their, not just their deep core, but their body as a whole. Like people will comment and be like, "Oh, I never knew I had that muscle." And so we're tapping into like smaller stabilizers, muscles that you wouldn't always get in a big
Mhm.
gym setting. So, like, when you go to a gym or you go to a fitness class, you're often working bigger, global, stronger muscles, the quads, the hamstrings, the glutes, and all that is really great and important. But if you're like a runner or an endurance athlete that's only ever going like forward and back in one plane, we have to usually address those side to side muscles or just those smaller stabilizers that play a really big role in so many different activities.
Yeah, our audience is probably people with a variety of uh, levels of familiarity with small stabilizers. And gosh, like, I mean, I just don't think about these muscles too much either, even myself. But what I do think about is maybe in the hips. What I see when people walk or stand or try to stand on one leg,
Right.
would be some of those hip stabilizers that might help you, stay upright and walk. I imagine that's part of it. Where are these stabilizer muscles? Are they in the hip in the back? Are they other places too?
They could be in any joint really.
Okay.
And it's the muscles that kind of help support and surround the joint. Um, and for example, like, because I was kind of brought up in this way of really efficient core awareness, like when I go to, pick up something heavy out of the fridge,
Hmm.
I'm not just using my shoulder muscle to like pick that up and bring it to me. I actually feel my core working to help prevent my trunk from coming forward when there's
Yeah.
a load in front of me.
Hmm.
Or, this comes into play pretty much throughout our whole day
Yeah.
when we're going to, stand up. Like, are you just using your legs? Are you using your legs and your core? And so a
Right.
lot of what I'm trying to do is um, make exercises super functional to what we actually have to do during our day to day life. So, if someone is a teacher and they have to walk up and down stairs all day to their different classrooms, and they are having hip pain during that, then how can we make going up and down the stairs more efficient so that it's not just, those hip flexors always like over overworking? How
Mhm.
can we make it both kind of the hip flexors and the low core working together so that there's a bit more balance?
Yeah.
Um, and it seems like that tends to be really efficient to where patients are now coming back and saying, hey, I'm noticing that my core is just gently active
Mhm.
during all of these, you know, times during my day. Like, I'm picking up my baby from the crib and I'm using my core, or
Mhm.
I'm reaching and using my core. So that's really the end goal. There's
Yeah.
a lot of specifics in the beginning, but I always tell people, like, I don't care if you can do like 100 sit-ups. I care that you're able to, you know, play with your grandkid on the floor and be able to get back up. I care
Bigger
that,
functional things. Yeah.
yeah, yeah. And it seems to me like having the awareness of our body and how it moves really helps people be able to be movers for longer amounts of time.
Yeah. Um, that's awesome. Yeah, I do think that building that body awareness is something that happens over time, and it does happen with athletic training for some of us as young people, and I can see that as we move on through life, it just changes, and we have to, I think, pay some attention, right, to our bodies and our movements to feel as good as possible.
Yeah, and it's interesting because when it comes to pain, especially chronic pain,
Hmm.
In my experience, I've found that there's also a balance there between having awareness of our bodies, but not having too much awareness of our bodies,
Hmm.
where we're really focusing on our bodies and pain too much.
Yeah, yeah, yeah. Where is that line or maybe noticing but not judging? Also, that
Exactly.
noticing.
Yeah.
Um, Sometimes there is hey, let's listen to our body. Let's While there are times it makes sense to do things that are uncomfortable, there are also times that your body's maybe giving you a message of like, hey, let's not do it in that way.
Right. And, I have had chronic pain for over 10 years now. And Pilates has always been something that has made me feel better.
Hmm.
And it's about maintaining the consistency. So when I was training to be a Pilates instructor, again, over 10 years ago, I felt so good. I even felt like
Yeah.
I was like, "Did I grow an inch?" Like, I felt so, like, together and tall and, like,
Yeah.
I just remember feeling the best I've ever felt, and I think that being able to have that consistent Pilates practice
Hmm.
over all of these years through chronic pain
Hmm.
has still gotten me to this like amazing level of what I just call maintenance and kind of like I have chronic pain, um, but I am not in any way like up here about it.
Yeah.
I know what to do and I know what my body likes to do. And I try to just give my body all that it needs
Hmm.
to be able to function day to day, despite still sometimes having chronic pain.
Yeah. 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 Well, tell us if you don't mind. I appreciate your kind of being willing to share.
Yeah.
A little bit about your own pain journey, and I probably would say we should probably have a whole other conversation about that because I know just the ability to have been through some of your own challenges, I think, has to be really good for just being able to relate to patients and their own journey, and especially as a physical therapist, right, where you're often in there doing potentially physical, maybe modeling a PT behavior or an exercise, and then also helping a patient get through being able to do it. Um, I tell me about how your own pain journey has informed some of your work.
Yeah, exactly. I started having neck and back pain in high school, and as it kind of continued on, you know, it was always a factor, and I was always wondering why.
Mm,
Um, I went to a lot of different doctors, the imaging, all the runarounds
sure.
that someone who's kind of young and in pain would
Mhm.
go through.
But doing the right things, I think, right?
Yeah.
Let's get this imaging. Medically, these are the appropriate things, although it doesn't always yield a clear solution of like, here's your plan and something effective that the medical establishment has for you, right?
Right. And the reason for that is because as I, went through PT school, I started really connecting the dots myself that there
Hmm.
might be, a connective tissue issue going on
Hmm.
here. And I remember the first time I had a physical therapist, kind of jokingly to me say, "Oh, do you have Ehlers-Danlos syndrome?" And I was like, haha, probably.
Hmm.
And it was, something that had been in my mind as I had gone through school and started to learn a little bit more about what my symptoms were, what the symptoms of EDS were. Um, and so it wasn't a shock and it wasn't, I guess, really a big deal in my mind
Hmm.
because of my education.
Yeah.
Um, and that's a different story than most people, I would say.
Yeah.
it's still frustrating regardless, you know, having no
Yeah.
answers for a long time was
Hmm.
hard and difficult, and my symptoms had been kind of getting worse through
Hmm.
PT school.
Hmm.
Just the stress of
Yeah.
that
Oh,
time
yeah.
was hard too.
Well, and what I would say that I see too is, maybe you might get a diagnosis, but that's not a total solution, really, because
Oh
it's
yeah,
really a problem. Ehlers-Danlos syndrome, if anyone that's watching isn't aware, is a connective tissue diagnosis. There is a range of what it is or what it looks like or what the experience is for the individual, but a lot of times it has to do with joint hypermobility and many other specific features and other problems that go along with it. Um,
yeah,
yeah, so there's just a range of what it looks like. There's a range of experience, but I think a common one is not being sure what's wrong. Numerous different challenges that may or may not look connected initially, but often are, with this diagnosis. And this is kind of what we see.
yeah. And the way that it kind of shaped my practice in my first like year of um, being a physical therapist, I found myself actually struggling a lot treating patients who were in chronic pain
Oh,
because I still wasn't in a place where I was like understanding of, you know, how to make this work in my life. And so
yeah,
the
yeah.
patient was coming to me and just it was draining
Mhm.
me. Like it was
Mhm. Oh, wow,
actually
yeah.
trying to educate them on what chronic pain means and what to do about it. I just felt it like coming out of me, just like me listening to their pain and their story, me physically feeling more pain by simply just being in the presence of like
Yeah.
chronic pain all day. And I ended up really having to like step away from those types of patients for a little
For a little
while.
while. Hmm.
And it wasn't until I did really my own work, um, and understanding and being in a better mindset, that now I feel like I
You're
have
ready.
almost like a gift of being able to talk to chronic pain patients in a way that like they know that I really get it.
Hmm.
And I'm able to speak in a way that is, you know, not gonna dismiss their pain. And I tell them that their pain is very, very real, that, what they're feeling and the sensations that they have are strong messages.
Hmm.
And so now I do find myself, especially working more with the hypermobility and Ehlers-Danlos populations. Um, we do spend a fair amount of time talking about chronic pain, what it means, where it comes from, and just doing a lot of mindset work. I know we talked about kind of the benefits of the Curable app
Yeah.
and how Curable Health has put together such a really nice way of, you know, you're observing these sensations and you're not ignoring them, you're not dismissing them, but like you're just thinking about them in a different way and trying to view your body and this pain through a lens of like safety. And that's like their big message of like, your body is actually safe right now. And that was really when, for
Yeah.
me, it kind of flipped, um,
To really reframe that. Yeah.
to really reframe that. And now,
Mhm.
again, trying to just help people through both movement and through that mindset approach, to really de-escalate their situation and their fears.
Yeah, that's awesome. Yeah, I think that sense of safety is so big, and I love that. And I've started kind of using that language with some of my patients too when they're really um, having a hard time, fathoming to move, that you can find safe ways, and it may take some work and some effort, but I think it is possible for sure,
Yeah, and
and so important.
that safe way can really be Pilates as a starting point.
Hmm. Yeah.
And I found that when people are, very fearful of movement, I've had so many patients be like, I threw out my back when I was doing this
Hmm.
specific thing. And now, you know, they'll say, I don't want to do that thing anymore, of course.
Hmm.
It becomes this fear avoidance behavior that they think it's going to happen again. So whatever caused pain in the first place, I'm not doing that anymore.
Yeah.
Or I don't lay on my back anymore. Or I don't, bend forward anymore.
Hmm.
And it's all these like self-limiting beliefs that further that pain fear cycle and then prevent us from living our lives and from moving.
Sure.
And so I kind of use Pilates as this starting point where like we're barely doing anything. We're actually
Mhm.
just starting with breathing.
Yeah.
And that is how we start to engage and activate some of these deep muscles simply by just, laying in whatever position is comfortable. If I try to get patients and I ask them, where is the most comfortable position that you have? It might not be laying on your back. If you're most comfortable in standing, then we're going to do exercises in standing so that
Hmm.
we prove to your body that it's safe. Um, and that we're initiating movement from a place of comfort and not just like, oh, here's a list of the exercises that I give every single patient.
Yeah.
The
We're going to
first
start
one,
with a customized plan.
yeah, the
That's
first one is like laying on your back, and I'm not going to have someone do that if laying on their back
they're
is
not ready.
comfortable. Yeah.
Yeah. That's great.
Um,
Well,
and everything is just so kind of like small at first, and I think that helps people just know and find safety, that like, and I'll even ask them like, how did that feel in your body? What did you feel in your body? And usually they'll say nothing, and I'm like, well, that's great.
oh yeah.
You don't have
That's,
to have pain when you're doing these things, so you shouldn't.
that's great.
Yeah.
Well, I want to help us wind it up here, because I do have a stop here for my own patients shortly.
Yeah.
But I did want to bring up for a moment for our audience and anybody that's interested, you are having a hypermobility masterclass.
Yes.
Um, Tell us a little bit about that, and I can see about adding a link for that here.
Yeah, that'd be great.
Yeah.
So the goal was to provide both more community connections. And when I thought kind of big picture about
Mhm.
what has helped me the most, it's not the nitty gritty of like, can I or can't I like eat this or do this, or hypermobile people shouldn't, or it's different for everyone. Every single person with hypermobility presents differently. So I try to think of topics that are going to help people that are hypermobile and who are dealing with chronic pain in a way that just is going to reach as many people as possible. So I'm holding 6 sessions that are every Wednesday evening starting in April.
Mhm.
And you will be one of the guest
Yeah, I'll be
speakers.
on. Yay.
Yeah. And so some of the topics have to do with, how to even prepare for your doctor's visit,
Yeah.
what to do before, during, and after so that you feel empowered.
Yeah.
Um,
And I think this could probably apply to most any patients with pain, but I think it's going to be particularly important for people with hypermobility or EDS. That it could be a great opportunity to make contacts in the community, meet new providers, and get some tips for living with this problem.
Yeah, and most of the guest speakers and providers are local, definitely in the Maryland area.
Awesome.
So that's should be really helpful, hopefully, if
Well,
anyone feels that connection and to reach out
yeah.
to them. Yeah.
Yeah, no, I think it's great. It's a wonderful idea. We're going to work to strengthen that network and just help all of our patients. So I appreciate your service to the community and that you're really looking to make an impact and create to hold space for patients and create a community. I just think it's wonderful
Thank you. Yeah, I do see a huge need still
for
to
sure.
just support
Yeah,
this group.
yeah,
Yeah.
because there's so much that I think people can offer one another when some of the important stuff is learning how to make your own adaptations. How can you live with this problem, work with this problem? That a lot of the solutions are things people can find for themselves or with each other. There's a role for you know physical therapy and doctors and stuff, but there's a big role for the patient too.
Yeah. Yeah. I think that's true.
Awesome. Well, thank you so much. I will leave it at that then for today. We'll put some links in the comments here to the hypermobility masterclass coming up. Thank you, Dr. Madeline Hoffner with At the Core Physical Therapy in Annapolis.
Yeah. Thank you so much for having me.
Yeah, take care.
Yeah.